Poultry farming is one of the major livelihood activities practiced throughout the country and has been proven to be very beneficial. Chicken raised intensively for their meat are known as broilers. Breeds have been developed that can grow to an acceptable carcass size of 2 kg in 6 weeks or less. Mortality rates at 1% are very much higher than for less intensively rare laying birds which take 18 weeks to reach similar size. In order to generate more income from this activity, chicken needs to be healthy and free from any diseases. For this purpose, one needs to understand their common diseases and vaccination. This disease is one of the most dreaded diseases of poultry, which cause heavy mortality rate at a very high speed, and it is highly contagious. The signs and symptoms for this disease are loss of appetite, greenish yellowish diarrhea, twitching of neck, difficulty in breathing, coughing and sneezing, and death by paralysis. 1-day-old chicks should be vaccinated by dropping the anti-vaccine in the eyes and the nostrils. After 2 months, the chicks should be properly vaccinated, and it is advisable to vaccine the adult birds at least once a year. The suffering birds should be immediately isolated from the flocks. Highly pathogenic avian influenza (HPAI) is highly lethal systemic disease affecting vast majority of birds caused by influenza type A virus. Water birds, migratory birds, ducks act as carriers and spread the infection. The signs and symptoms for this disease are watery diarrhea frequently present, and birds are excessively thirsty. Lack of appetite and edema of the face and the neck may also be seen. It is highly contagious even to humans. Vaccination is the only way to prevent this disease. This is highly contagious virus for young chicken, especially 4 to 5 weeks age, causing serious economic losses. The signs and symptoms for this disease are diarrhea, lack of appetite. This disease can be prevented by vaccination. Young birds are most susceptible to this disease, and the mortality rate is almost 100%. The signs and symptoms for this disease are appearance of boils or black spot in the eyelids and on other unfeathered area of the body. The eyes and the nostrils often become covered in yellow, cheesy discharge which sometimes causes respiratory trouble. The skin of the suffering bird should be washed with Dettol and silver nitrate, or a saturated solution of picric acid can be applied on the affected part. Newcastle disease vaccine or Ranicate vaccine. In this vaccine there are 2 strains. Number 1, the F1 or the Lasota vaccine given to 1-week-old chicken. Number 2 is R2B vaccine, should be continued after the F1 when the chicken is 1 month or a month and a half old. IBD vaccine or infectious bursal disease vaccine, which is given to chicken who are 2 weeks of age. It is administered by putting drop in the eyes or the nose of the chicken, or even mix it in the water. Fowl-pox vaccine. Chicks above 4 weeks of age should be vaccinated with fowl-pox vaccine on the wings. Poultry vaccines are widely applied to prevent and control contagious poultry diseases. Their use in poultry production is aimed at avoiding or minimizing the emergence of clinical disease at farm level, thus increasing the production.